Protein is absolutely necessary for your body, and there's a catch-22 because in the medical field, a lot of times they're giving you the dangers. They're telling you you're eating too much protein. The reality is that you're not assimilating. You're not able to use most of the protein. I'm going to tell you what to do about that. So there's a catch-22 because, I'll get into that. So you need protein, and I'll show you that next. And there are dangerous signs that you have that your body can't absorb enough, and there are things that you can do about it. So let's first talk about why you need protein. And if you're aging like I am, if you're not getting enough protein, just pay attention to if any of these are signs for you, and even young people now, frankly, because of our lack of digestion, which I'll go into in a little bit. But why do you need protein? What does protein do? I can't move my face, so I can't move this picture. Anyway, it balances the fluids in your body. So if you have, you just feel swollen, you have the swollen ankles, maybe you've high blood pressure, if you are retaining water in your body, there's a good chance that you're not assimilating enough protein and you're not able to balance the fluids in your body. There is also the enzymatic reactions. You need enzymes in your body to support your hormone system. So if you have any hormone problems, if you need hormone replacement therapy, if you need medications for your hormones, there's a good chance that you are not assimilating and using enough protein. So distributing oxygen throughout your body, protein helps the transport of oxygen through the bloodstream. And why is that important? Oops. I don't know if you saw that. Let me get to the next screen. Okay. Symptoms that you have low blood oxygen. And if you have low blood oxygen, you might not have assimilated enough protein in your body. You could have shortness of breath, headaches, restlessness, dizziness, rapid breathing. You could have chest pain, confusion, high blood pressure. You're not coordinated. You're having visual disorders. So just think about if you have any of that. I personally think we do not have enough protein in our bodies. We're not assimilating it enough. Okay. But there is a danger in trying to do that. And I'll get into that too. Oh, how do I move this thing? Okay. I don't know. Building and repairing cells. So if you damage any organ in your body, your protein is the building block that your body needs to repair the cells. So if you get any bruises, any injuries, you need the protein to repair that organ in your body. It's just part of it. Your immune function. Protein is a key part of the immune system. It helps fight off bacteria and viruses. It maintains your body structure. So as we're getting older, we tend to fold over and we shrink and everything kind of compresses. If we've been injured, if you're into sports and weightlifting, you know that you need that protein to rebuild your muscle. And protein is used to maintain the body structure. It is also a primary source of energy. So people that I work with, when they start getting the right amount of protein in their body, their brain clears, the fog on their brain starts to go away. They start having more energy, more pep in their step. So it is a very important part of energy. And it also aids in movement, just the movement of your body in and of itself. Now, a lot of people, when we get older, you lose your energy, you need to sleep more, you just don't have any energy. I would propose to you, just think this through. If it is a source of energy, if you are not able to assimilate, meaning digest and use it and have it dispersed throughout your body, then you're going to have a reduction in energy. It's just the way it is. So it's very interesting, I think. Let's look at the next one. I hope this is truly recording. Okay, right. Other benefits of eating protein: reduce your appetite and your hunger levels. It increases your muscle mass and strength, and we need that, especially as we're aging or if we're weightlifters and we want to be nice and strong. So I'm in my mid upper 50s, and because I assimilate protein through what I'm sharing with you, I don't have to have the muscle loss that a lot of people are starting to get my age. It's good for your bones. It lowers your blood pressure and it helps maintain weight loss. And there's a really great trick I have for that as well. Now, before we go on to the rest of this, remember, medications suppress. Medications hide your symptoms so that you feel better. They can hide your symptoms so much that your blood tests get better, but you still have some kind of process going on in the background that is not working. It's making your body not work. Okay, so medication suppress. I should probably give an example of that. Acid suppressing drugs for your stomach. If you have acid reflux, you take an acid suppressing drug. And we'll go into that in a minute, but you actually need to have your acid in order to digest your proteins. And so if you're suppressing it, if you're suppressing that acid and not managing it and not making sure it's optimized, you're not going to digest your protein. I don't even know if that was a good example here, but medication suppressing pain. So you get in a car accident, and so you take a bunch of painkillers so that you feel better. But meanwhile, you had whiplash, and so research shows that up to 3 years after a car accident, if you don't take care of what happened with the whiplash, there's a little bit of brain damage that's happening in your neurological system throughout up to 3 years after a car accident, even a little 5-mile-per-hour fender bender. So medications suppress, so it would suppress your pain versus supplements, or in that case, I don't know, I should have thought of a better example, but whatever, here we are. Supplement support. So the whiplash example, so that would be actually chiropractic, I think is the best thing for whiplash, but supplement support, it helps make you stronger. Look at those pictures together, right? One of them is like, I don't want to hear from you. I don't want to know what's going on. Like, let's just make you go away so I can deal with my life. And the other one is supportive and loving and making sure that everything is enhanced so that you can go about your life. Okay. Needed to digest protein. Okay. In order to digest, meaning in order to assimilate and use all the protein that you eat, you have to have the correct acid in your stomach. You have to have gallbladder or colical, which has a colical or quality source bile salts. You have to have pancrealytic enzymes. Your pancreas produces enzymes. So in the medical system, they say, oh, you don't need your gallbladder because your pancreas is going to produce some of the enzymes that you need to break down protein. It does not produce the level of support that your body needs to really break down protein so that your body can use it. You cannot, what's blocked on here, you cannot utilize protein adequately if you have bypass surgery. That is not what it looks like on there. Bypass surgery, if you take antacids or other acid suppressants. So there's a whole, on the bypass surgery, that's a whole other story, but you are not getting the acid that you need to assimilate your proteins. You're just not, but there's a solution. Now, you need strong exit channels for protein waste, bowels and kidneys specifically. And now let's go into, so this whole topic came up because one of my friends sent me a message and said, here's the dangers of too much protein, but let's go into that. Can you eat too much protein? So that's the article that was sent to me. You can go look it up there. And yes and no. Yes and no. There are warning signs that your body cannot assimilate the protein that you're eating. So that's, again, the kidneys and your bowels, basically. So let's look at what they're saying. So they're saying that when you eat more protein than your body needs, I disagree. It's not that your body needs, it's then your body can assimilate. Your kidneys work overtime to process that. You need to have healthy kidneys in order to deal with the waste from the food that you're eating. And so that's where really high protein diets, you can damage your kidney, but all you need to do is support your kidneys or find a way to get the protein into you that is not going to put stress on the kidneys, which I will get into. And the next one. Foamy or bubbly urine. That's proteinuria or a high level of protein in your urine. That is an indicator of kidney damage. So are you getting too much protein? Or are your kidneys just not strong enough and healthy enough to handle the protein that you're getting? I would assert that your body needs more protein. Otherwise, we wouldn't be having all those symptoms of getting weak, brain fog, depression is one too. You wouldn't be having all those symptoms if you were assimilating enough protein. But you can, if your kidneys are not strong, damage your kidneys. So if you're not going to take the recommendations that I'm going to be giving you here, then I would say stick with this and lower your protein because you need your kidneys. Okay. You need at least one kidney, right? Vital to life. So if you're not going to be very careful in how you are bringing the protein in your body, then look out for bubbly urine, right? But another way that you can take care of that is to strengthen your kidneys. Okay, which I'll get into in a little bit. Kidney stones, there's a natural remedy for that, which I'm going to give you a link to. It should be below. It doesn't heal it. So I should say it's not a remedy. So it supports your body in strengthening your kidneys in such a way that your kidneys become inhospitable to kidney stones. If you do your regular medical protocols for that. Okay. Irregular bowel movements. Eating any nutrient in excess, including protein, can make it hard to digest and lead to digestive issues such as constipation. Right. You need to have plenty of water. You need to make sure that you have adequate fibers, such as leafy greens possibly for you, or it could be also slow cook oatmeal. Slow cook oatmeal is one of my favorites. Slow cook oatmeal, not fast cook, because fast cook isn't going to help as much, if at all. And yeah, so okay, that's all I'm going to say about that. But you also might need support for your bowels because that goes back to your liver, which is a detoxifier. It is one of the main detoxifiers in your body. That with your kidney deals with toxins, and so you want to make sure that your liver is strong to help with that upstream of your digestive system. Okay. Weight gain, that they just had this in the article. I don't know. They say that it may be counterintuitive that eating too much protein could lead to weight gain. I don't know anyone. No, I can't say that. If you eat a lot of protein, but you're also eating a lot of carbs, absolutely you're going to gain weight. It's the carbs. And then they tell you how to reduce protein intake. And like I said, if you're not going to pay attention to what I'm about ready to tell you, then do what they say for sure. And I would say also get somebody who's going to help you, somebody else. So find somebody who's going to help you. Just find somebody who's going to guide you through this so that you do it safely. But I want to give you this information because I know that a lot of us like to just try to just get in there and take care of it. First step, strengthen your kidneys. You've got to strengthen your kidneys because of what they talked about. There's if you have any of those issues, that could be a problem. Arginex is one of my favorites. Indications are kidney overload, which is what we just talked about, that overload from eating more protein than your body can handle, or in the medical perspective, you're eating too much protein. Are you? Or is it just your body can't assimilate it, right? Urinary tract infections, high uric acid, gout. It helps detoxify the kidneys. The kidneys are our main organ for removing toxins from the body. So removing toxins from the body. So the other thing about toxic load on your kidneys is the quality of the meat that you're eating, the quality of the protein that you're getting. If you're getting it that's been injected with hormones and steroids and it's been bleached and all that stuff, that if you're in this paradigm that you know that you've got to get from your local farmer, grass-fed, ideally grass-finished, from your local farmer who's not using all these pesticides, herbicides, antibiotics, like all the drugs and all the things that are putting toxins in your food. So if you're getting mainstream meat, you've got an extra load on your body because those foods are just messed with. Okay. This is, you can pause this here and get that page. That's kidney stone nutritional support. So lots of people have had success in preventing kidney stones from progressing by supporting their kidney stone, by strengthening it. This is not a cure. It is not a treatment. It is nutritional support to strengthen your kidneys. And that's the whole protocol on there for that. Okay. You got to clean up the toxins entering your body. The easiest is figuring out what to put on your skin. That's the less toxic stuff on your skin. The one you have the most control over is your diet, but that's also the hardest one to do. I will tell you, though, that these 3 products, Detox and Cleanse, vitamin and mineral shake, plus LifeWorks essential aminos, when you do those 3 together, and you can do them for all 3 of those together, and just do that for 2 weeks, clean up your diet, that's going to strengthen your whole exit system through, it'll support your kidneys, your liver, everything. Here's some information on the essential aminos. And so it's the essential aminos is composed of pure essential amino acids, the building blocks of protein, in a form of ratio that is up to 99% utilized. So if you are not, so that means, what that means is you have less waste. So that's why I love the essential aminos, because you're not dealing with the waste. So it's really safe for people who have kidney damage to use this at a high degree, and they don't have to worry about their kidney having to detox a bunch of stuff. Of course, I would recommend Argenx and other kidney support, but this doesn't have all the junk in it, and it gets the protein in your body. And lots of people have used this too, especially as you're aging, to help with bone pain. Clarity of mind is probably the best one for that. For energy, all the things that we talked about a little bit earlier, this is your bypass and your cheat if you want to not really worry about making sure that you're getting quality proteins that don't have waste, and you'd rather just kind of do the elimination of regular proteins. This is a little bit of a cheat. Getting quality proteins is a whole other topic, but this is about how do you get proteins in your body, and not how do you get enough proteins in your body. So I would say everything that I said here, get the essential nutrients in your body, make sure that you're having you eat quality products, and that you take those essential aminos. I think everybody needs to take those, especially if you're 55, everybody needs it. So hopefully this answered some questions. So your body needs protein, and I hope this inspired you and gives you more insight and information. And again, if you're not willing to get quality proteins in your body, if you're not willing to make sure that you're paying attention to your digestive system and making sure that you have the right amount of acid in your stomach, then go ahead and do the essential aminos and make sure that you pay attention to whatever your regular medical provider tells you, because most important is that you are safe and careful with yourself, and know what you're willing to do and not willing to do, and just be honest with yourself so you can take the best care of yourself possible. And for a lot of people, that means following the regular medical route. So my best cheat for you would be the essential aminos. I'll have a link below for where you can get that on my website. That is only available by providers. And let me know if you have any questions, and if you have any insights or experience with when you've taken essential aminos and it's helped you. All right. Thank you for watching. Please like and share.